When a deadly disease threatens the lives of millions of people, developing a vaccine is only part of the solution. Producing it in mass quantities, distributing it, educating healthcare providers on how to use it, and convincing hundreds of millions of people to get vaccinated can be just as difficult. PATH is a nonprofit organization dedicated to solving the biggest problems in global health for the most vulnerable people on the planet. For more than 40 years, PATH has been at the forefront of the fight against nearly every major global health challenge, from malaria to HIV/AIDS to malnutrition. Founded by 3 researchers in Seattle, PATH now works in more than 70 countries and reaches 200 million people each year. CEO Steve Davis leads this pioneering organization to achieve extraordinary results through partnerships.
We sometimes talk about that we're in the unsexy middle of what is the innovation value chain. We don't do a whole lot of basic research. We don't have big wet labs. We rely on partners, industry, academic, social sector partners who do a lot of basic research. We also don't have lots of people on the ground who are operating facilities. We rely on partners, governments who actually have the clinics on the ground to do distribution. The only way we're gonna ever tackle some of the biggest challenges in the world is by bringing together private sector companies and governments, nonprofits, community organizations, and academic institutions. We need to bring all those together in order to get great things done, and we've continually at PATH shown the power of that approach. It's not as easy as just let's go into a lab and come up with a new vaccine and throw it over the fence and suddenly magic, it happens. Innovation is a complex journey, and certainly Menafrovac vaccine followed that path the same way a lot of other products and services we do. Meningitis A is a horrible disease. On an annual basis, it rolls across what we call the meningitis belt of sub-Saharan Africa, killing a lot of kids, but also disabling and leaving neurologically damaged kids in its wake. The ministers of health of those regions, of those countries, came to the table and asked, look, you have a vaccine for meningitis in the rich world. We need one for this horrible disease. So PATH came together with both public partners like the FDA and WHO and various governments, private sector partners, and said, we're gonna commit to developing a vaccine to address this strain of meningitis. Then it was bringing together the existing science in the area, the existing players. We found lower cost manufacturers in India. Menafrovac was really the first vaccine that was developed for the Africa continent. Around 300 million people now have received that vaccine, and we're on the verge of eliminating meningitis A from Africa. When I think of PATH's legacy, sure, I want people to know what we accomplished and the innovations that we introduced, but the legacy's not about PATH. It's about the people we touch and what they do with their lives. It's those 150, 200 million people a year who's not sick or didn't die and now can go contribute to their family or their community and go to school or go change the world themselves. That's the legacy that we care about.